Good morning, everyone. So in this video, I'm going to discuss with you about to study the effect of the drugs on frog's heart. So this is the experiment in pharmacology, frog's heart. In this video, I will discuss with you about the effect of the stimulant, depressant, and to know the effect of the unknown drugs on the frog's heart. So first of all, before I start this video, I want to request you, if you like this video and if it is helpful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika Pharmacology Discussion. So now I'm going to start. So first of all, what is the heart of the frog is? It consists of two atria and one ventricle, superior vena cava, inferior vena cava, which drain into the sinus venosus, which drain the blood into the sinus venosus. So venous blood जो है, it comes from the inferior vena cava and superior vena cava. They drain into the sinus venosus and then they enter the right atrium and then they enter the ventricle. Arterial blood from the left atrium, it enters the ventricle, and then when it enters the ventricle, ventricle pumps the blood to the aorta, and aorta has the spiral wall that directs arterial blood to body and venous blood to lungs through pulmonary artery. So aorta has the spiral wall which will direct the arterial blood from the ventricle to the body, and venous blood from the ventricle will be pumped into the lungs by the pulmonary artery. So it has no walls and conducting tissue. So this is the how the parasympathetic and sympathetic nervous system, they act on the frog's heart. Sympathetic is supplied by beta 1. Sympathetic is by the adrenaline. So when the beta 1 receptors are stimulated on the heart, they will lead to increase in heart rate and increase in contractility. In parasympathetic, when M2 receptors, that is muscarinic 2 receptors, are stimulated and there is a release of acetylcholine, they will lead to decrease in the heart rate and decrease in the contractility. And this is the SA node, this is the SA node, this is the AV node, this is the AV bundle. These are Purkinje AV bundle branches, and these are Purkinje fibers. So this you already know. So now next is adrenergic and cholinergic drugs. They produce the opposite effects on the heart, and the drugs act via various receptors, but some drugs act directly on the heart. So as you know, adrenergic, they are stimulant drugs, and cholinergic, they are depressant drugs, and they act via various receptors on the heart. So stimulant drug, as you know, indirectly acting is that drug which acts through the receptor, through the stimulation of receptors in the heart, and directly acting is which acts through the CNS. So stimulant drug will be adrenaline, indirectly acting, and directly acting will be calcium chloride, and depressant drug will be indirectly acting will be acetylcholine, and directly acting will be potassium chloride. So apparatus of the frog's heart, what we require is we require a medium-sized frog to place the frog over the boat, and frog boat. We require simple writing lever to note the contractions of the heart rate, and on the lever, on the chymograph on which the paper has been attached. So simple writing lever for the contractions, venous cannula for the infusion of the infusion fluid into the perfusion fluid into the from the in the venous, in the sinus venosus. So we have a venous cannula which is attached to the drip set. Murphy's reservoir, which contains the perfusion fluid, and when it enters the sinus venosus, it enters the right atrium, and then it comes in the ventricle. So next is chymograph to record the contractions, to know about the contractions. Dissecting instruments, pithing needle is pithing for the frog. We do the pithing, that is we insert the needle in the depressed area of the between the cranium and the atlas vertebra. In the depressed area, we insert the needle and we destroy the brain, and then we come downwards, and then we also destroy the spinal cord. Means double pithing is done in the in case of the frog heart, And when the double fitting is done, there is loss of refluxes. That is, there may be loss of corneal reflux. That is when we place the stick or something, some pen or stick near the cornea. There will be no blinking of the eyelids. And there will be also loss of deep touch and pain reflex, because when we touch the limbs with the stick or any pointed object, there will be no reading. Means there will be no further reading. There will be no jerking movements will not be there of the hind limbs and the forelimbs. So the scissors are given to for the dissection, and then syringes for 1 ml, syringes for the injection of various drugs, scale and pencil to record the heart rate amplitude and to record the heart rate contractions. So adrenaline, the strength is 1 in 10,000. It is the indirectly acting stimulant. Acetylcholine 1 in 10,000. Strength, indirectly acting depressant. Calcium chloride 1%. It is the directly acting stimulant. Potassium chloride 1% is the directly acting depressant. And in this experiment, we also need propranolol and eptopin to block the effects of the stimulant and the depressant drugs. That is, when we want to block the adrenaline effect, we will give propranolol, which is the non-selective beta blocker, and when we have to block the acetylcholine effect, we will give the eptopin like cholinergic depressant. So next is the procedure. We have a frog rana tigrina. It is double bit, destroying both the vein and the spinal cord by pacing needle until deep refluxes, touch, pain, and all other reflexes are lost. We have to check it that whether the corneal reflex has been lost or not. So what we have to do is we have to cut the skin and the muscle layer from the groin and reach up to the throat of the frog. See this. From the ground, we will cut from the ground of the pelvic girdle, we will give the incision, V-shaped incision will be given. And then we forwardly cut up till the pectoral girdle to the throat of the frog. Like this is the skin of the frog. This is the muscle layer. This is the pectoral girdle. We reach the pectoral girdle after from the pelvis to the pectoral girdle, and this is the below the pectoral girdle there is presence of the heart. So cut through the pectoral girdle and attack to expose the. Now when we reach the pectoral girdle, we will cut the pectoral girdle. We will attack the pectoral girdle and expose the heart in the pericardial sac. And then pericardium is removed and the heart is lifted up. See this heart. This is lifted up. So sinus venosus is calculated using a venous cannula, and the cannula is secured with thread. So a hook is passed, sinus venosus is generated with venous cannula, and then a hook is attached with a thread through the frog's heart in the sinus venosus part. And the inlet of the perfusion fluid is sinus venosus, and outlet is the truncus arteriosus, which is present in the branch of the aorta. That is the outlet of the perfusion fluid, and the perfusion fluid in this case will be frog ringer, and it enters to the sinus venosus, taking precaution that no air bubble should pass through the heart. Perfusion rate is 30 to 40 drops per minute. Perfusion is passage of the fluid through an organ with one inlet and one outlet. That you already know that it is the perfusion is passage of the fluid from one inlet and one outlet. So then afterwards, when we expose the heart and we attach a hook to tied to the thread, attach a hook with thread to the frog's heart. Like this, we will attach a hook while passing the thread. So this is how the experiment. This is through the ventricle it is passed the hook, and then this is the sinus venosus. This is the sinus venosus. This is the truncus arteriosus, which is the outlet. This is the inlet. This is the crescent line visible as a pale line in atrial systole. This is ventricle. This is left atrium. This is right atrium. This is the common inferior vena cava. This is left atrium. This is opening of the thorax. This is left aortic arch. So next is this is the experimental setup of the frog pulmonary heart preparation. This is how the heart preparation, frog pulmonary heart preparation is set up. So now we have to study the effect of the inotropic and chronotropic drugs on various drugs, stimulant as well as depressant on diffused frog's heart in situ preparation. These drugs, I have already told you that these are the epinephrine, norepinephrine, acetylcholine, propranolol, atropine. These effects we will see. Potassium chloride, calcium chloride. First of all, what is heart rate? Heart rate is counting movements of the liver, one heartbeat, one up and one down liver movement of the liver. Heart rate is one upward and one downward movement. That is one contraction. That will be one heartbeat. Heart rate is how many heartbeats per minute. Amplitude of the contraction will tell us about the force of contraction. Tonus shift of the midpoint systolic and diastolic contractions means what is the shift from the baseline of the midpoint of the systolic and diastolic contractions, that will be the tone. And now we have to inject the 0.5 ml of the stimulant drug adrenaline and take recording for 60 seconds. So what we have to do is we have to inject adrenaline, which is indirectly acting stimulant, and then we have to take a recording for 60 seconds. Then we have to stop the drum, wait for 30 minutes. Because we have to wash the frog with the perfusion fluid, and then we have to wait for 30 minutes. Then we have to start the drum. After taking the recording, we have to wait for 30 seconds, which is the washout period. Then we will take the controlled contractions, and then we will see why we wash out is to abolish the effect of the previous drug. Then we inject the 0.1 ml of the calcium chloride, and then we note its effect. Then we take the control reading. Because after washout period, we will take the control readings, and we will inject the acetylcholine and note its effect, and take the control readings and inject 0.1 ml of the potassium chloride and note its effects. So this is how we see the effect of the stimulant and depressant drugs. So this is how we see the effects of the, like, potassium chloride is the directly acting depressant, and acetylcholine is the indirectly acting depressant, and calcium chloride is the directly acting stimulant, and adrenaline is the indirectly acting stimulant. So this is how we see that when we give the controlled contractions, we give 0.1 ml of adrenaline. There is increase in the heart rate, increase in the amplitude of contractions. Temperature we have to keep as room temperature. Frog Zinger solution we are taking. Speed of chromograph is 0.25 mm per second. Rate of perfusion is 32 drops per minute. So acetylcholine, there is depressant effect, and these are controlled contractions. So this is how we see the effect of the stimulant drugs. See this, these are normal contractions. Then we inject the adrenaline. There's increase in heart rate, increase in force of contraction, increase in tone. And then we take the controlled contractions again after washout period. Then we insert the calcium chloride, and we see the systolic arrest. That is the there is an increase in the heart rate and increase in the force of contraction. Then we take the controlled contractions, and then we insert the propranolol, which is the beta blocker, beta 1 receptor and beta 2 receptor blocker. Then we wait for 5 minutes. Then we again insert the adrenaline. We see that there is no change in effect of the heart rate and force of contraction and tone, because the beta 1 receptors are blocked, so no effect will be seen. But when we inject the calcium chloride again without giving the washout period, there will be increase in tone, heart rate, and amplitude of contractions will be increased. So this is how we say that this is the effect of the stimulant drugs. Means these are, adrenaline is the indirectly acting stimulant, calcium chloride is the directly acting stimulant. Indirectly acting means adrenaline is acting through the receptors. So these receptors are being blocked by propranolol, so no effect is seen. But when we insert calcium chloride, there will be effect. So this is the effect of the depressant drugs. This is the normal contractions. This is acetylcholine, 0.1 ml, 0.1 10,000, 1 is to 10,000. Depressant effect will be seen. We again insert, we take the controlled contractions, then we insert potassium chloride. Again depressant effect will be seen, then we give the controlled contractions, and then we insert the atropine, and then we will wait for 10 minutes, then we insert acetylcholine. Again the depressant effect will be reduced, or no depressant effect. But again when we give the potassium chloride, depressant effect will come. This is because the atropine is the M2 receptor blocker, so acetylcholine effect has been abolished. So it is the indirectly acting stimulant, and this is the potassium chloride, which is the directly acting depressant. Indirectly acting depressant. This is the directly acting depressant. So that's all for the. This I have already told you. This is adrenaline, which is the indirectly acting stimulant, acetylcholine, which is indirectly acting depressant, calcium chloride, which is directly acting stimulant, potassium chloride, which is directly acting depressant, propranolol, and atropine. So that's all with my effect, to see the effect of the drugs on the stimulant and depressant drugs. In the next video, I will discuss with you about the effect of the unknown drugs on the frog's heart. So I hope you like this video and it is helpful to you. If it is helpful to you and it is useful to you, kindly subscribe to my YouTube channel. This is Dr. Nitika, Pharmacology session. Thank you. Happy learning. And in the next class, I will discuss with you the effect of the unknown drugs on the frog's heart.